Okay, now, however, there are some individuals, even if they are infected with microorganisms, they do not get sick, they do not develop signs and symptoms. Okay? They appears to be healthy, but they have the microorganisms in their body. We call them as carrier. Again, even if the person has microorganisms, but the person is not showing any signs and symptoms of the disease or infection, the patient is called as carrier. So that means, even if you have coronavirus, but you are not coughing, you do not have fever, you do not show signs and symptoms of coronavirus, you appears healthy, that means you are a carrier. Okay, that is reservoir. And the next part of the chain is the portal of exit. We have the microorganism that lives in the reservoir. Now, for this microorganism to cause infection to the other patient or other individual, it has to leave from the reservoir. Normally, microorganisms get out or leave the reservoir through portal of exit. And what are the common portal of exit of our patient? Our nose, mouth. Coronavirus, they usually exit from the nose when we cough, when we sneeze. Microorganisms will live from our nose and mouth. There are some microorganisms that exit from the anus. There are some microorganisms that exit from the wound. Okay? There are some microorganisms that exit or leave the reservoir through the mucous membrane. For our eyes, mucous membrane. That's why it is important for you as future nurses to know what is the portal of exit of this microorganism. Where these microorganisms lives, the reservoir. Why? Because you need to control those things, and that is your role as a nurse. Okay? See this example, see this drawing. The microorganisms might live in the might live or exit in the mouth, or in our skin, or even in our urine, or even in our feces or stool. Microorganisms can be there. Now, this is very important. Another important part of the chain of infection is called the mode of transmission. When the microorganism exit from the nose or mouth, for it to cause infection to the other patient, it has to be transmitted through this mode of transmission. Okay? Again, the microorganism is leaving from the reservoir, for example, through the mouth when the patient's cough. Okay, for this microorganism to cause disease to other patient, it has to live through a mode of transmission. Okay, or mode of transfer of this microorganism to other patient. We call it as mode of transmission. Okay, now, there are 4 common ways wherein the microorganism is transferred to the other patient. The first one is the direct transmission. This is very, very common. Okay, in some books, we call this as person to person. When you touch the person, you will get sick. When you touch a patient, you will get sick. When you bite a patient, or the patients bite you, you will get the disease. Or someone kissed you. Maybe the patient's coronavirus. Okay, from mouth to mouth, that is direct transmission. Even sexual intercourse can be a good way of transmitting microorganism from one person to another. And the mode of transmission is called direct. However, there are some microorganisms that can be transmitted to other patients even without contact. And we call it, number 1, vehicle-borne transmission. See? Transfer of microorganisms through a vehicle. Maybe these infected patients did not touch, did not kiss, or did not bite this patient. Okay. However, the microorganism in these patients might lodge into the surroundings of the patient. For example, in the cell phone, in the computer keyboard, in the doorknob. Okay? And then when the healthy patients hold the cell phones, the doorknob, the keyboard, the other person will get infected. They did not touch each other. However, because of vehicle, okay, we call it as vehicle, because of fomites, or maybe the microorganism is transferred into the water or food, maybe because the sick patient prepared the food for the family member, and the microorganisms went into the food. Even without touching the other patient, the healthy patients will get sick. Why? Because the microorganisms is transmitted through vehicle. Could either be cell phones, it could either be materials, it could be some things which the infected patients might touch. Another example of transmission of microorganism is called vector. It doesn't require direct contact to the patient. We call it as vector. And when we speak of vector, we are referring to animals and insects. You will get sick even if you're not going to touch the patient. But if you are bitten by some animals, some insects, you will get sick. For example, mosquito. You might have dengue fever. Okay? Or you might have malaria. The mode of transmission is through vector or animals or insects. Now, this is the most important mode of transmission. We call it as airborne. This is the most common. This is very timely. You need not to touch the patient itself, but you will still get the infection. Why? Because the microorganisms are transmitted through droplet. It's in the air. It is in the form of dust. And the moment a healthy person inhales the droplet or the dust with microorganisms in it, the patients will be infected. Okay, these are the 4 different types of transmission: person to person, vehicle, vector, or animals or insects, and the last one is droplet or dust. This is very important. Without the mode of transmission, the microorganisms cannot transfer to the other patient. Okay, now let us see if you are able to answer this one. If you will be asked in the exam with this question, when a mosquito or a fly, fly, small fly, carries an organism that infects another living organism, this mode of transmission is infection via, okay, what are your answers? Okay. Is it through vehicle? Mosquito. Is it a fomite? Fomite is object. Is it a direct? No direct contact there. So the answer is a vector. Why? Because a mosquito, a fly, is an animal or insect. Very good. Now, the microorganism now is transmitted through the 4 modes. It has to reach the patient. It has to enter to another host for it to cause infection. Okay? And normally, infection will occur if the microorganisms could look for an entry. And what are those potential entry in our body where the microorganisms can go in? The most common is in the skin, especially if you have some wound. Microorganisms can also pass in the nose and mouth. Microorganisms could also enter into the anus, reproductive system, open wound, and mucous membrane. In short, microorganisms can live through these areas, and microorganisms can also enter. That's why portal of entry and portal of exit is the same. Where they go in is the same on where they go out. Portal of entry and portal of exit. And the microorganisms should reach the portal of entry in order to cause infection. This is very important. Even if the microorganism is very dangerous and it successfully infected other patient, now, do you think infection will occur? It depends. Okay, it depends. Even if the microorganism is very dangerous, it depends on the host. Okay? And normally, infection will occur if the host is susceptible. As I mentioned earlier, A susceptible host are those individuals where immune system is low. That's why you would notice with this coronavirus, most of the victims are those who are elderly. Why? Because elderly have weak immune system. We call them as susceptible. They are at risk from infection. Who else? Babies and children are very susceptible. Why? Because their immune systems are underdeveloped. Who else? Cancer patients are also susceptible. Why? If you have a cancer, your immune system is low. And if your immune system is low, you are prone to infection. Okay? However, being a susceptible or being at risk for infection is also affected by several factors. And we have mentioned here two types of factor that should be in order for a susceptible host to develop infection. Again, even if the microorganism is strong, if the host is not susceptible, infection will not occur. However, if the host is susceptible, the host is very young, the host is very old, the host has a cancer, or the host has a low immune system, then infection will occur. And these specific defenses and non-specific defenses are the different protection of a patient against infection, like intact skin, mucous membrane, or vascular responses. And of course, the immunity. If the patient has immunity against that disease, he will not develop infection. Or if the patients receive vaccines, do you know what is vaccines? Immunization. That means the person is protected against infection. Okay, now, these are okay. Again, what are um, uh, the different links or the chain of infection? First, agent, and this agent should live in the reservoir. And for this microorganism to infect to other patient, okay, it has to exit, okay, okay, and then after after exiting from the patient, this microorganism has to be transmitted to other patients by the mode of transmission. Okay? When this microorganism is transmitted to other patient, it has to enter into the portal. We call it as portal of entry. And the last but not the least, the microorganism should look for a susceptible host, okay, in order to develop or cause infection. Okay, now, talking about susceptible hosts, we're talking about susceptible hosts. They are the individual who are at risk of infection. I'm going to show you on the slide right now 4 types of patient. Now tell me, among these 4 types of patient, who are the susceptible patient? A 29-year-old postpartum patient. Postpartum means patients who just deliver a baby. B, a 42-year-old patient who had uncomplicated dental extraction. Uncomplicated means no problem. No problem during dental extraction. Letter C, 76-year-old client with hip fracture. And letter D, 18-year-old athlete. Athlete, maybe football player with knee sprain. Among these patients, who do you think will cause infection right away? I can see 8% saying 42 years old. Uncomplicated means there is no complication. There's no problem with dental extraction. 29-year-old who just delivered the baby. Are they susceptible to infection? Okay. 89% says 76-year-old client with hip fracture. And this is the correct answer. Why do you think this is a correct answer? Because of the age. 76-year-old. Remember, as I mentioned earlier, the age of the patient is a factor. If you are old enough, if you are young enough, you are susceptible. Okay? So this is the chain of infection, and they are linked together. For the infection to occur, all six should link together. This is how important the chain of infection is. Now, as nurses, our role, our responsibility is to make sure that infection will not occur. But how do you do that? As we mentioned earlier, the six elements of infectious process are linked together to cause infection. And the best way that we can do in order to break the infection, to address the infection of the patient, is to break anywhere on the six links. You have to break, you have to loosen the chain. And how do you do that? How do you break the chain? How do you stop the infection? Okay, I'm just going to mention few important ways on how you can break the infection on each element. For example, remember our first um, our first element is infectious agent. So what do you do now in order to break the infection process? You kill the microorganism right away. How do you do that? These are methods on how we can kill them. You disinfect, you sterilize, you clean the surroundings, you boil the supplies or materials. Those are the ways where you can kill the microorganism. I'm going to discuss that later on. Okay, now, at this chain, the reservoir itself, reservoir, it is where the microorganism lives. So how do you break the infection in the reservoir? Of course, you cannot kill the person. As I mentioned earlier, the humans are the favorite reservoir, but you cannot kill the person, right? Instead, what you can do is to clean the surroundings. Okay, environment cleaning, proper food storage, water treatment. Why? If you do these things, microorganisms will not live there. Okay? We also have portal of exit. We said microorganisms live through the nose, through the mouth, through the anus. So how do we deal with those things? Once the patient stops, or once this patient sneezes, what will you do with the sputum? Eventually, you clean it. You dispose the sputum, the secretions. That is how you control the microorganisms. That's why when you cough, you are asked to cover your mouth with a tissue or a handkerchief so that you can control your excretion and secretion so that the microorganisms will not cause infection to other patients. Okay, so how do you break the infection in mode of transmission? The same process. You need to wash your hands because of the direct contact. You need to clean the environment, or you need to put the patient in a separate room so that the microorganisms will not spread. Portal of entry is the same. Hand washing, cleaning of the wound. Okay, this is very, very important. As I mentioned earlier, infection is more likely to occur if the person is susceptible. So how do you improve the health of your patient? How do you improve the health of yourself so that you will not get sick? First, make sure you have your immunization. Even if you are exposed to microorganism or infection, if you have complete immunization, you will not get sick. Okay? Of course, nutrition. You need to eat healthy food because even if there is microorganism there, even if there is infection there, if you are healthy, you will not get sick. And of course, treatment and recognition of high-risk patient. If you know someone who is infected, a microorganism, you have to treat it right away. You need to give medication. You need to identify them. Okay? These are the ways on how we can break the chain of infection. Okay, now, okay, what would be our role as nurses? How do we prevent infection? How do we make sure that the patient is free of infection? You will hear the word aseptic technique. When you go to the hospital or next week when you go to the lab, your teacher would say practice aseptic technique. Okay? And when you hear the word aseptic technique, it is our method, it is our process, okay, that we do in the hospital in order to prevent microorganisms or infection. Your teacher would say, practice aseptic technique, do aseptic technique. These are ways and processes that we nurses can do in order to control or prevent infection in the hospital. I'm going to show you what are the different ways on how we can prevent or control infection. Okay? And normally the term that we use to describe absence of microorganism is asepsis. And as nurses, our goal is to make sure, okay, that microorganisms are absent or asepsis. That's why when you go to the hospital, most nurses, most doctors are performing asepsis. And when we say asepsis, we are talking about medical asepsis and surgical asepsis. Again, asepsis means absence of microorganism. When we say aseptic technique, these are ways or processes in order to prevent or control microorganisms. Now, how do we control microorganisms through medical asepsis? Very simple. Daily nurse routine. You clean the bed of the patient, you do hand washing, you clean the environment. Those are medical asepsis. And the goal of medical asepsis is just to reduce the number of microorganisms. Okay? And of course, we have surgical asepsis. If medical asepsis is just to reduce the number of microorganisms, surgical asepsis is you destroy microorganisms. When you go to the hospital, there are some procedures or processes that they are doing there in order to destroy or kill microorganisms. And we're going to discuss that in our next few discussions. Okay? And normally, we perform surgical asepsis, especially if we're going to perform surgical procedures. Amalia, surgery. That procedure requires surgical asepsis. There should be no microorganisms or else the patients will get infection. Okay, now, these are the infection control measures that you should perform or that we should follow in the hospital to prevent infection. Okay? And the first method and the most famous is hand hygiene. Okay? This is one of the most effective way of controlling or killing microorganisms. Hand hygiene. It could either be hand washing or it could either be hand rubbing. You wash your hands or you use sanitizer. The use of sanitizer itself is called hand rubbing. Hand hygiene could either be hand washing or hand rubbing. And in the hospital, there are 5 instances wherein you need to perform hand hygiene. First, before you touch the patient, you hand wash. Okay? After you touch the patient, again, because you have microorganisms in your hand, you wash your hands or you apply sanitizer. Or if you want to perform a procedure to the patient before you do that, hand washing again. Or when you go to the bedside, you touch the patient's bed, you touch the patient's surroundings, again you do hand hygiene. And of course, if you perform procedures wherein there are some blood, there are some urine, there are some body fluid, and you were exposed to it, it came into your hands, the more you need to do hand hygiene. I want you to memorize these 5 moments. This is very, very important, okay? Especially when you go to the lab next week, you will be asked by your teachers, when do you perform hand washing? When do you perform hand hygiene? You need to mention these 5 moments. Okay, what else? Aside from doing your daily hand washing or periodic applying of sanitizer, there are some other ways on how you can protect yourself. And this is very important, especially that we have coronavirus now. We call this one as use of PPE. Okay? PPE or personal protective equipment. These are materials that are being used by healthcare workers in order to prevent infection or to prevent transmission of microorganisms to other patients. And we have the most common mask. All people are wearing masks now. That is one example of PPE. And the very purpose of mask is what? The very purpose of mask is to protect, okay, transmission of microorganisms through droplet or airborne. That's why you put a covering. Another one is gown. You know, some microorganisms, maybe from when the patient's cough, the microorganisms will go into the patient's gown. If you are not protected, if you are not wearing gown, more likely you will get infection as well. What else? Okay, gloves is very important, especially if you are touching a patient, especially if the microorganism can be transmitted through direct contact. You need to wear your gloves. You don't want to touch microorganisms. Also, you need to do shoe cover. Mister, why we need to wear shoe cover? Because there are some microorganisms on the floor of the patient. And once you go to the other patients, you will be bringing those microorganisms. Okay? Eye shield is very important. Remember, as I've mentioned, portal of entry is mucous membrane. So when somebody coughs and the microorganism reaches your mucous membrane in the eye, or the blood, or the body fluid, okay, comes in contact with your mucous membrane in the eye, you will get sick. And in order us to prevent that, you wear eye shield. And of course, ear cover. In most instances, if the microorganism is very dangerous, you need to cover your hair. Why? Because some microorganisms might stick into your hair, and when you go to the other patient, microorganisms will move to the patient. Okay. Okay, now, this is very, very important. Can you still hear me, guys? Hello?
Yes, we can see you.
Okay, now, this is very important, and I want to finish this one before we, there's no slide? Okay. There's no slide, guys? My computer?
There is a slide.
Okay, there's a slide. Okay, now, remember, as we have mentioned, the microorganism has 4 modes of transmission. It could be transmitted through direct contact, it could be droplet, or it could be airborne. These are the 3 most common ways on how microorganism is transmitted. Through airborne, through contact, or through droplet. Now, what is transmission-based precaution? Transmission-based precaution depends on the microorganisms of the patient, which means if the microorganisms is transmitted through airborne, there are specific protective equipments that you need to use. If the patient's infection is transmitted through direct contact, there is also specific PPE that you can use. This is called transmission-based precautions. The use of PPE depends on the type of microorganism that is causing the infection. Okay, let us discuss one by one. The most common way wherein microorganism is transmitted to another patient is through direct contact, as I mentioned earlier. When you touch the patient, when you touch the wound, you might get the infection. Why? It is direct client contact. Now, if the microorganism is transmitted through direct contact, what are you going to wear? Technically, you don't want to touch the wound. That's why you wear gown or you wear gloves. Especially if you are dealing with, gastrointestinal secretion, the vomitus of the patient. Especially if you are cleaning the wound of the patient, if you are touching the skin of your patient, you need to wear gloves and gown. This is applicable if the infection is transmitted through direct client contact. And of course, you need to put your patient in a private room. Now, what if the microorganism is transmitted through droplet? You know droplet, when you cough, the microorganisms will fly in the air, okay? And eventually it will settle onto the object. We call it as droplet infection, okay? Now, if the patient has a droplet infection, normally we wear surgical mask. You will see in the photo right now, the patient is, the nurse is wearing surgical mask. And what are those infections that can cause droplet infection? If you have pneumonia, if you keep on coughing, if you have mumps, if you have pharyngitis, definitely the precautions that you are going to do is to cover your nose and mouth with the use of medical mask or surgical mask. And of course, you need to put your patient in a private room. And this is the most important one. Droplet infection, as I mentioned earlier, the moment the patients cough or sneeze, the microorganisms are capable of flying on the air. If the infection is droplet, okay, normally after a few minutes, the microorganisms will settle into the floor. However, if the microorganism is transmitted through droplet, they are suspended in the air for several hours going around. And because droplet infection can fly, that means they are very, very, very small. That's why we use a special mask or nose covering called N95. Because if you use the ordinary mask with droplet infection, because the microorganisms is very, very small, they can still penetrate. So that means if you use this mask for droplet, it's not effective. Why? Because airborne, this is airborne, not droplet, sorry. Because airborne infection is very, very small. They can fly for several hours and they're very, very small. It can penetrate into your ordinary mask. It's not effective. Instead, for airborne infection, we use N95 respirator or N95 mask. And of course, if the patient has an airborne infection, the microorganisms are flying, you cannot put your patient in the ward. You need to put your patient in an isolation room. Isolation room means the patient is exclusively placed in a separate room other than the patient. Or else, the microorganisms will infect the other patient. See, this is a classic example of the difference between droplet and airborne. Droplet, the microorganisms, when you cough, when you sneeze, after few minutes, because the microorganisms is very large, they will settle into the object. However, for airborne, once the patient sneezes or cough, the microorganisms are suspended in the air for several hours, okay, causing infection to other patients. Now, this is just an additional to what we discussed because this is very, very common. You might ask me, Mr. There is a coronavirus now. So how do we protect ourselves? What PPE are we going to use? Before you can answer that question, you need to answer this. What is the mode of transmission of coronavirus? What do you think? Is it contact? Is it airborne or droplet? The coronavirus is a droplet infection. Okay? Remember, as I mentioned earlier, if the infection is caused by droplet, we can protect ourselves with the use of mask. However, although coronavirus is a droplet infection and the use of a simple mask is okay, however, if you are working in the hospital, okay, usually in the hospital, there are some procedures that causes these microorganisms to float in the air for longer time because of certain procedures, such as, when you do intubation, when you suction the patient, microorganisms are suspended in the air for a long time. That's why when you go to the hospital, most nurses are wearing a complete gear to protect themselves. However, in general, for us ordinary people, we can protect ourselves from coronavirus by simply wearing a mask. And of course, hand washing. Okay, these are procedures that causes coronavirus to be transmitted through the air when the nurse performs suctioning, when the nurse performs intubation to the patient, coronavirus is more fatal because they might suspend in the air. Now, in our exam, I'll be giving a scenario like this, and I will be asking you, which one will you use? Again, in answering this question, you need to go back to the transmission-based precaution. What is the disease? What is the infection? How it is transmitted? Then you will know which type of PPE you're going to use. Now the question is, a nurse is planning to clean the infected wound of a patient. Which PPE should the nurse use prior to patient contact? What do you think? You are the nurse. The patient is a wound. What are you going to use? Give me your answer. Remember the condition infected wound. If the patient has infected wound, what will I use? Okay, what will you use? What will you use? Okay, remember infected wound, which means the microorganisms in the infected wound can be transmitted through what? Direct contact. So the answer is very good, 70%, gloves and gown. So the answer is gloves and gown. Okay, it seems that you have a class at 3:35. So you have a class at 3:35, and I think I still have very few slides, 7 slides. Okay, here's what I'm going to do. I will record my discussion, the continuation of my discussion. I will record it, and I will upload it into the Moodle so that you can just open the video if you want, okay? And you can try to review it. Is it okay? And next week, if you have some questions before we start the discussion, you can ask us several questions just before we proceed with other topic. Okay? Because I think you have a class at 3:35. Any questions? Any questions just before we end this class? Am I too fast? Am I too slow? Or is it clear? By the way, again, announcement. The remaining 8 slides, I'm going to record my discussion and I'm going to upload it into the Moodle. And you need to review it next week and read it. Okay? And next week, before you start our new discussion, if you have some questions, okay, we're going to answer your questions first. Okay, any questions just before we leave this Zoom meeting? Clear? No question? If you have some questions after I close this one, you can send me your questions through the email. Okay? Now, thank you so much for participating in this class. And again, see you on Monday. Okay? For now, bye-bye. And see you on Monday. You can close now. Thank you.